we good to go? Smita, are you there? Dr. Jalaja?
Yes, sir, we are here.
Doctor is there. We just find out. Yeah. Good evening, doctor. Can we start?
Yes, sir. Good evening.
Yeah, good evening. Yeah, dear colleagues, a very warm good evening to one and all. As we all are aware that Azadi Ka Amrit Mahotsav is an initiative of the Government of India to celebrate and commemorate the 75-year of progressive India and the glorious history of its people, culture and achievements. It also forms an apt backdrop to celebrate the contribution made by our women. Women have played pivotal roles in nation building throughout its growth journey and have left indelible marks in all the fields besides being nurturers at home. Indian Man too has championed for active participation of women in the workforce and taken many steps for bringing parity in opportunity and recognition. Today, about 30% of our workforce consists of women. Further, while March 8th is celebrated world over as International Women's Day, as a part of celebration and in continuation with our series of wellness webinars conducted by the bank last year during COVID times and this year during Omicron, with the motivation given by our top management, MD and CEO, we have today arranged for a webinar on diabetes and women. We have with us Dr. Jalaja to address our concerns. Dr. Jalaja is senior consultant, diabetologist and pregnancy diabetic specialist in St. Isabel Hospital, Chennai. She is member of many medical associations, to name a few: Indian Medical Association, Indian Diabetic Association, American Diabetic Association, Pepsi Diabetes in Pregnancy, and member of ICMA Registry of Diabetes in Youth. She has her she has to her credit many prestigious awards, such as the famous Blue Ring Award from International Diabetic Association for services rendered in the field of medicine, Best Patient Care Physician from Lions Club, Paul Harris Award from Rotary Central Madras Club, Award in Diabetic Management by American Diabetic Association. Dr. Jalaja has published more than 10 research papers in peer-reviewed journals in the field of diabetology and psychology. She has conducted more than 50 free diabetic camps for women and senior citizens. Besides being a speaker in various national and international conferences, she has delivered health awareness lecture in various colleges, schools, and public forums. She also appeared as an expert on NDTV Delhi on awareness on COVID. On behalf of the entire Indian Bank family, we welcome you, Dr. Jalaja, for today's webinar. Now, I'll request Dr. Jalaja here. We from Indian Bank, we have this webinar is being released through YouTube, where our customers are also watching, and we have the other link through which WebEx link through which our entire India, our staff is and our executives they are watching, and a few people we have taken on this WebEx link also. So with that few words, I'll request Dr. Jalaja to start. Maybe in the beginning, whatever time I want to take, post that if there are questions on YouTube or other channels on our WhatsApp, whatever we'll get, we'll try to ask from Dr. Jalaja. And on this presently people available on this WebEx list are also, if they have some question, they can ask. Now I request Dr. Jalaja to take over the mic from me.
Thank you very much for the kind introduction. It's my privilege and honor to be a part of the International Women's Day program with the Indian Bank. I'm being a diabetic specialist, especially for the pregnant women. I feel very happy to present this on Diabetes and Women program. Can you start the slide session, sir?
Yeah.
Next slide, please. Diabetes is a chronic, we all know, diabetes is a chronic metabolic and vascular endothelial disorder which is progressive, characterized by elevated blood sugars. And the most commonest cause for the diabetes is insulin resistant or insulin secretory defect. Diabetic people have insulin. Insulin is a hormone. Whatever food we eat, they enters into bloodstream. converts into glucose. But insulin is required to remove the glucose from the blood and give to the cells as energy. The diabetic people, the insulin will not function properly, that's called insulin resistant, and the secretion of the insulin is blunted, so they are called as an insulin secretory defect. There are about 63 types of diabetes. After the four types are very common. The one is type 1 diabetes. The second is the most commonest one, type 2 diabetes. The majority, 80% of the diabetic population belong to type 2 diabetes. And the third is a gestation diabetes. And fourth is the other diabetes like drug induced. That is called maturity onset of diabetes in young. Next slide, please. According to IDF, International Diabetic Federation, diabetes is one of the fastest growing global health emergencies of the 21st century. Next slide, please. Next slide, please. I've taken this from our IDF International Diabetic Federation Atlas. Approximately about 537 million adults between 20 to 79 years are living with the diabetes. The total number of people living with diabetes is projected to rise to 643 million by 2030 and 833 million by 2045. It's quite alarming. And of that, 3 or 4 adults with diabetes are living in the low and the middle income countries. And if we take even 240 million adults of diabetic or even undiagnosed, they don't know even they have diabetes. The diabetes costs about 6 million deaths. Next slide, please. Not only that, more than about 1.2 million children and adolescents are living with the type 1 diabetes. And 1 in 6 live births, about 21 million people are affected by diabetes during their pregnancy. So, apart from this, the most important thing is about 541 million adults are at increased risk of developing type 2 diabetes. Now, let's see one by one. Next slide, please. There are so many factors. What are the risk factors for someone to develop diabetes? The first and foremost is the family history of diabetes. Either father, mother, or both parents or siblings, the risk increases. If the parents are diabetic, the risk of one developing type 2 diabetes ranges between 50 to 80%. Then overweight or obesity is a very important cause, is an independent risk factor for somebody to develop diabetes. And eat unhealthy diet, eating more of a junk food, processed food containing trans fats, these are the one is a very important risk factor for someone to develop diabetes. And of course, physical inactivity. Increase in age. As age advances, the risk of one somebody developing diabetes also increases. And high blood pressure, ethnicity. We Indians are high risk to develop diabetes at a very young age. When compared to the Western Caucasian population, 10 years before result, we got more increased risk to develop diabetes. And people with IGT or otherwise called pre-diabetic, and people with the past history of gestation diabetes, and most importantly, poor nutrition during pregnancy also, the fetus is tuned to develop type 2 diabetes in future. So we all know what are the common symptoms of diabetes like polyuria, polydipsia, polyphagia, like frequent urination, increased appetite, loss of weight and all those things. And lack of energy, extreme tiredness, slow healing of wounds, then recurrent infection of the skin, urinary tract, dental infections like that. And some people may just even present with the blood vision or with the recurrent style or tingling or numbness in the hands and feet also they may present. Not necessarily everybody present with the typical symptom of diabetes. Surprisingly, 40 to 50% of the type 2 diabetic are asymptomatic. They've been casually diagnosed to have diabetes when they go for some health checkups or when they go for the job, when they evaluated their health, that time only the diagnosis were detected. Next slide, please. So we all know about the diabetes from head, it affects from head to foot. It doesn't spare any organ in our body. What you know about this is not to get fear. If you understand fully about diabetes, it will be easy and our mind will take up a thing that how to prevent diabetes in future. So diabetes can affect head to foot, and we commonly call as a macrovascular complication and microvascular complication. The macrovascular complications, diabetic people are more prone to develop cardiovascular problem, which is called as a coronary artery disease. Can cause stroke, can cause vascular disease of the feet. So we call it as macrovascular disease. Diabetes can affect the kidney also. We call it as a diabetic nephropathy. What are the microvascular disease? Like diabetic retinopathy. Diabetes can affect the eyes. A simple thing like dryness of the eyes or a recurrent eye or somebody the specs power keep changing. They have to check for diabetes. It's one of the simple clue to understand a person may be a hidden diabetes. Then there's something called diabetic retinopathy, which is preventable and treatable. Diabetes retinopathy is one of the leading cause for sudden loss of vision, blindness in the diabetic people. But it is preventable and treatable if it is diagnosed earlier. And apart from that, diabetes can cause dental infection like periodontitis, gum infection, and all those things. So, but not to fear about. If you maintain a good glycemic control and if keep a good blood pressure control, if you monitor the sugars, you can live healthy with the diabetes. Next slide, please. India lies second after China, so home for diabetes. Not only that, diabetes is epidemic in India. We keep talking about COVID pandemic, but diabetes is a big pandemic. Globally, every country is affected by diabetes, either by developing countries and developing countries. So, especially now we found recently there is an increase in the incidence of the pregnancy diabetes. We call it as gestation diabetes. Maybe an increase in the obesity or diabetes, lack of physical activity like in the COVID time, majority of them are isolated in the home, they're not able to do the physical exercise. We are seeing a lot of new cases of diabetes after COVID infection. The COVID virus even attacked the pancreas, a new onset of diabetes are detected in dog. Now, polycystic ovary disease (PCOD), we are seeing a lot of young girls having this polycystic ovary disease, which is an important risk factor for somebody to develop diabetes. So the gap between the number of the diabetic men and women in India is slowly decreasing. In those days, diabetes is more occurs in the men, but nowadays diabetes frequency or the prevalence or incidence of diabetes is slowly increasing in the women also, almost equal proportion. Next slide, please. Next slide, please. Okay. Now, let us come to the today topic. Diabetes in women is increasing because most important thing is increase in the incidence of obesity and lack of physical activity. Many people work from home. The physical activity is reduced a lot and excessive stress. I like to highlight about the stress. We have been bombarded by stress, personal stress, physical, official stress, and some job stress, so many stresses. And the stress is a very important factor to push somebody to diabetes, which we will be addressing it later. And lack of adequate sleep, especially good night sleep. The sleep hygiene is not followed nowadays. The late night sleep or majority of time we spend with the gadgets, phone and all those things to disturb our sleep pattern. Sleep is a time where all organs in our body get regenerated, including our brain. So people even develop memory disturbances, even they don't sleep properly. Especially the short-term memory get disturbed very much if you don't sleep properly. Difficulty in remembering the name, numbers, where they kept the phone, key, and all those things. Short-term memory get disturbed when the sleep is getting disturbed. And the next important factor is abnormal eating habit. It is skipping of breakfast. In the name of diet, people skip breakfast. They undereat and prolonged fasting and all. So everything has to be planned. Diet has to be balanced. And skipping of breakfast, people who skip the breakfast are more prone to develop type 2 diabetes in future. The studies have shown that. There is an increased prevalence of polycystic ovary and associated with a thyroid dysfunction. Many young girls have got a thyroid dysfunction, hypothyroid nowadays. Even I'm seeing a lot of male patient, male diabetic having a thyroid dysfunction. And the hormonal changes, which is very specific to the women, either due to early menopause or surgical menopause. See, many women having the uterus, they have fibroid, enlarging fibroid, or they have a heavy bleed. They're forced to remove the uterus. This is called surgical menopause, and all those things can push a woman to developing diabetes because there is no hormonal support. They lose the hormonal support when the uterus is removed, but it all depends upon the how we prepare ourselves for the menopausal period, which we'll be dealing later. Next slide, please. And diabetes in women is significant and different. Why? Because the hormones, the inflammation, and the amount of excessive stress in a woman can make the diagnosis and management difficult. Especially changes in the hormonal, whether before or during the menstruation period, affects the blood sugar level. See, many women think the symptoms of diabetes, which I already told, explained it, like this extreme tired, and they think because they overwork, they overstressed because of the feeling tired. So, like that, the treatment, the diagnosis and treatment getting delayed because of that. Next slide, please. Yeah. The different stages of the menstrual cycle, either it is follicle or luteal phase, may have an effect on the blood sugar level due to the level of the estrogen and progesterone. In the premenstrual period, in some patients we see increase in the level of the blood sugar can come due to the temporary insulin resistance produced by the hormones like estrogen and progesterone. And the blood sugar level can reduce during the menstruation begins. So generally we recommend better to avoid checking your blood sugar for the first time. Somebody want to understand whether they have diabetes or not, better to avoid checking the blood sugar during periods or few days before the expected date of the periods. Again, in the perimenopause women, due to the hormonal fluctuations, what happens? The sugar also fluctuates. Not only the mood swings for a menopausal women, the sugar levels also swings. Now let's just see the diabetes in women, children, like they develop type 1 diabetes, girl child, they develop type 1 diabetes, early onset of type 2 diabetes. We are seeing a lot of young girl children having type 2 diabetes. When we are witnessing even patients having type 2 diabetes at the age of 15 and 18 and all. And the diabetes in teenage can produce a delayed puberty, can produce irregular periods, can present as a polycystic ovarian disease. Diabetes in the reproductive age can produce subfertility and gestation diabetes also. Next slide, please. Now, diabetes in the middle age, generally they present as type 2 diabetes, may be associated with hypertension. We all know 50% of the diabetic people can have hypertension, blood pressure, and 40% of the hypertension patient can develop type 2 diabetes in the future. These both are the deadly dose. May be associated with the coronary heart disease, can be associated with the thyroid, can be associated with the depression. And the diabetes in the old age, generally, they present after menopause. Next slide, please. Now, diabetes may be harder. Let us see first the women, the younger reproductive age group. Diabetes may be harder in young women because diabetes can produce various difficulties during pregnancy. Why do you know about all these things? So that we can be precautious. So always be better to be proactive than reactive. So if we understand these things can occur, if we take a prophylactic measures, we can prevent this. That's the reason been telling what are the possibilities somebody can develop during the reproductive age, they develop diabetes. When a woman become pregnant, they have diabetes, there are more chances to develop miscarriage. The baby can develop congenital deformities. There is something called stillbirth, like intrauterine death, or they come out with the big babies, macrosomia babies. So unplanned pregnancies can lead to increase the risk of diabetes and congenital anomalies. For example, in a family, if there is a strong history of diabetes, if the parents have or a sibling has got diabetes or she had a gestational diabetes, is a wise decision to check the blood sugar level, plan the pregnancy, then proceed. Otherwise, sometimes unplanned pregnancy can lead to complications. A diabetic woman during pregnancy, they can develop retinopathy, or if they already have retinopathy, it may worsen also. There is something called pregnancy diabetes is basically divided into pre-gestation diabetes and gestation diabetes. Pre-gestation diabetes means already a diabetic woman becoming pregnant. Gestation diabetes is the diabetes detected for the first time during pregnancy. Though gestation diabetes generally disappears after delivery, it also holds the risk to develop type 2 diabetes in future. The risk is about 50 to 80 percentage in another 5 to 10 years if they don't follow adequate precaution. So pregnancy is a window of opportunity to prevent future diabetes both for the mother and the baby for next two generations. Next slide please. Diabetes is unique in women because this disease can affect both the mother and baby, unborn child. How? The mother's high sugars, if the sugars are not controlled, it can go to the baby. The baby gets extra nutrition. It secretes its own insulin. We call it as hyperinsulinemia. The baby secretes its own insulin. The pancreas of the baby starts functioning from 20 weeks onwards, intrauterine period. So the baby can become a big baby. A big baby or a macrosomic baby has got more risk to develop childhood obesity. That baby, if it develop adolescent, they can develop PCOD or gestational diabetes. So to break the cycle, the prevention of diabetes should be started in utero. So women with the diabetes should always be very careful. If they maintain a good balanced diet, follow the steps adequately, definitely can develop a healthy mother and the baby. Moreover, diabetes with women always experience some sort of depression. And women with the diabetes are more vulnerable to develop some sort of complications like coronary heart disease, retinopathy, and nephropathy. Next slide, please. Now, let's see about the diabetic kidney disease. That is, next slide about the diabetic kidney disease. As I have told about the diabetes can affect even kidney also. So this diabetic kidney disease is when compared to the male population and the women, it comes quite severe. But how to prevent this? A good sugar control of keep HbA1c around 6.5 to 7. A good blood pressure control of 130 by 80. A good lipid control, especially total cholesterol, good cholesterol, bad cholesterol. A regular walking, yoga and meditation. And not only that, when if we do things also, something like when you study also, we need to attend the exams. Then only we can understand where we stand. Like that, even if you follow a good balanced diet, even you keep a good sugar control, even you do regular walking, one should monitor the sugar levels and should monitor the kidney function. There is a test called serum creatinine. It has to be monitored once in 6 months. Checking serum creatinine alone may not be useful. There is something called eGFR. What is eGFR? It's called estimated glomerular filtration rate. This eGFR will tell how much percentage of the kidney is functioning well. So it can detect the kidney problem in a very early stage. And one more interesting factor is there is a test called urine for microalbumin, which can detect the kidney function. It can detect the kidney failure in a very early stage. It can even reverse the kidney problem if it is detected early. If a urine microalbumin is corrected with the diet and medicine, the people can come out developing kidney problem at all. We can prevent diabetic kidney disease. Next slide, please. Now, heart, diabetes and heart. We know diabetes is a major risk factor for somebody to develop heart disease, especially in women. The heart disease is an important cause for mortality for the women with the diabetes. Women with the diabetes are 2 times more likely to develop second heart attack when compared to a non-diabetic woman. Not only that, they're more prone to develop heart failure when compared to the non-diabetic women. Nothing to scare about it, but you should understand these are the possibilities out there. So you should develop. I will be in the next few slides. Will be telling how to prevent all these problems. So women with a type 1 diabetes can develop a heart disease even at a very young stage. Next slide, please. Now, this I like to highlight it. The warning signs. So typically, heart attack means everybody knows they develop a chest pain, they have profuse sweating, the pain may radiate in the hand, and all those things. But in a woman, the heart attack symptoms can be different. The warning signs of the heart attack are different in men when compared to the women. How? Many diabetic women may just present only as a nausea. They may develop a jaw pain or even shortness of the breath or back pain or a difficulty breathing or upper abdomen pain instead of experiencing the typical chest pain. So, anybody develops such sort of symptoms, not to panic immediately. First, let them try it. Maybe a possibility of gas, maybe a possibility of costochondritis. So, let them take a medicine to relieve the gas. But the pain is not subsiding within 30 minutes of taking medicine to reduce the gas. It's always better, especially a diabetic woman who's overweight or have got hypertension, better to take an ECG and find it out. Is always a wise decision because in a heart disease, the golden time is very important. We can save a person if they reach the doctor in time. So diabetic people, especially women, can have heart attack, even chest pain, and they always the survival rate is little less when compared to the men. And women experiences the already I told high mortality and morbidity from the diabetic complication when compared to the men. Next slide, please. And women with the diabetes lose the premenopausal protection from ischemic heart disease. If you closely watch in women, so about 20s, 30s, and 40s, generally they don't develop heart attack because their hormones, estrogen and progesterone, protect their heart. The same woman then loses her hormone either in the menopausal period or surgical menopause, they are at more risk to develop heart attacks. But the same person is a diabetic mean the risk also increases. So generally what happens in the women, they have higher HDL, high density lipoproteins called good cholesterol when compared to men. But when a woman becomes diabetic, her HDL cholesterol reduces and hence the heart protection against her coronary artery disease is lost. Next slide, please. Okay. We have to understand the basic, like generally what happens as age advances in blood vessels, the size starts shrinking. It's quite common. The elasticity of the blood vessels are lost as age advances. But a person is a diabetic or a postmenopausal, the blood vessel shrinks still more. It's almost become like a hard pipe. We know we got 4.5 liters of the blood. The blood remains same, but the blood vessel size is shrunken. So the blood has to flow to that with a high pressure. And the size is when the lumen is small, the sugars are uncontrolled. The sugar can deposit inside the lumen. The sugar, if the cholesterol is not kept under control, again the bad cholesterol can get deposited in the lumen. So what happens if the uncontrolled diabetes, uncontrolled cholesterol levels, the high blood pressure, all these things flow to the blood vessel, they stay in a certain part producing clot. This clot only proceeds as a heart attack. So that's the reason for some patients we use aspirin and so. So it is very, very essential. All diabetic people not only should control the blood sugars, they should control, if they have blood pressure, they should keep the pressures under control. If they have cholesterol, they should control the cholesterol along with the dietary modification. There are certain medicines called statins which has to be taken so that they can be away from the cardiac complication. And certain medicines like aspirin, the blood thinners can be used if the doctor feels they are the high risk to develop coronary artery disease. So unnecessary stunts and unnecessary surgeries can be prevented. Bypass surgeries can be prevented. The patient able to take care of the blood sugar, blood pressure, and keep the cholesterol under control. All these things can be prevented. Next slide, please. Now, what is the heart healthy diet? See, medical nutrition therapy is a cornerstone in the management of any disease. It includes diabetes. Diet plays a very important role. There is no doubt about it. And diabetes is a lifestyle disorder also. So let us understand what are the heart healthy diet. Almonds and walnut are heart friendly because it protects the heart by increasing the good cholesterol and omega 3 content. But we all know almonds has to be soaked overnight, the skin has to be removed and should be taken. The skin will interfere with the nutrition absorption. So better to soak overnight, remove the skin and chew it. Walnut is very good. I always tell my patients to take almonds in the morning, take flax seeds or chia seeds, and fenugreek seeds also very good, and take almonds in the evening as a healthy snack. Onions and garlic seems to be cardioprotective. And you should avoid saturated fat and trans fat. All these chips, potato chips, and all the junk foods, processed food contains trans fat. Whenever you buy a food, any food, you just go through the food label, find it out how much percentage of the trans fat is. And you should avoid taking deep fried items once in a while, and should avoid mutton. And too much of coconut should be avoided. Coconut oil is good. Coconut can be taken, but too much to be avoided. And you should also avoid excessive oil. Just because it's olive oil, just because it's sesame oil, it doesn't mean we can take how much you wanted. But everything, quantity control, portion control is very important. Next slide, please. Now, so the most important one is physical act. Apart from the diet, the physical activity. The maintaining an ideal body weight, it's a very important tool to protect ourselves from the various lifestyle disorders like diabetes, hypertension, even cancer, and so many problems. So, regular physical activity is very much needed, and diet has to be taken properly, and you should reduce our stress level. And most important thing is that we should always take the medicine. The compliance, adherence to the medicine is very important. Like any doubts whether to continue medicine, stop the medicine, never do by itself, always get the help of the doctor and do it. Because every medicine a diabetic person takes has got his own role in preventing the diabetic complication. Next slide, please. Let's see about the retina. The women, I already told retina, it's called diabetic retinopathy. Diabetes can affect the heart, especially in the long duration of diabetes. So diabetes is present for a longer duration, say about more than 10 years or 15 years, are more prone to develop retinopathy. And women has got more risk to develop eye problem when compared to the men. And people with hypertension also got more risk to develop diabetic retinopathy. So next slide, please. So diabetic retinopathy, it is nothing to worry about. It's preventable and treatable. Why do you know about all these complications? So if you are aware of the complications only, we can diagnose it earlier and prevent it earlier, so that you'll be away from the problems. So moreover, diabetic retinopathy is silent. Many times the patient may not feel anything at all. Sometimes they may have little blurring of vision, or sometimes they feel some sort of dots or some floaters in front of the eyes. They feel some dust or some ink blots like that sometimes can come. But it's so that's the reason we tell it's mandatory. All the diabetic people should screen for the diabetic retinopathy every year is mandatory. And all pregnant women with the diabetes should screen for retinopathy every trimester. We divide pregnancy into 3 trimesters: first trimester, second trimester, third trimester. So every trimester, the pregnant woman has to be screened for the retinopathy, because I already told the retinopathy can develop during pregnancy diabetes, or the pre-existing retinopathy can worsen during the pregnancy. So it's mandate. Again, the same thing, good sugar control, Good blood pressure control, if it is there, will definitely delay the development, progression of the retinopathy. Next slide, please. Next, let's see about osteoporosis, the bone health interview. Normally, when compared to the male population or women, the bone is very small, the thinner bone, the cortex is also very thin. The bone volume itself quite less when compared to the male population. So, normally, what happens up to 20 to 25 years, the bone strength increases. The bone gathers all the nutrition by the time. It's called peak bone density, occurs between 20 to 25 years. And after 35 years, slowly, the bone density keep reducing. And a diabetic, everybody occurs 10 years before itself. For example, somebody developing cataract is 60s and 50s, a diabetic people can develop it instead of 60 years, they can develop cataract at 50 years itself. Because in a diabetic people, the there's something called chronological age and the vascular age. What is chronological age is their actual age. Somebody, say a person X is there, is he or she age is 40 years. His duration of diabetes is 5 years means his vascular age is 45 years. His blood vessel will resemble like a 45 years old person, though his real age is only 40 years. So that thing we have to understand. This is called vascular age, chronological age is different in a diabetic person, whether it is male or a female. So in a women, what happens? I already told the bone is thin and cortex is thin and all. They're more prone to develop osteopenia and osteoporosis. Osteopenia means decrease in the bone mass. Osteoporosis means the bone is becoming thinner and thinner. It is almost like a puppet. The more prone to develop fractures at a very trivial injury. Just if a fallen down also, they can develop a trivial injury. Just lifting up heavy weight, we have listened to so many stories. The other has gone to toilet, he has just fallen down, they developed a hip fracture. This is called osteoporosis. So, what are the symptoms? Sometimes not only that, if we closely observe, after a certain age, the height can decrease. A decrease in the height is an important factor, gives a clue that somebody is having a vertebral collapse or a osteoporosis. DEXA scan is a test which can detect osteoporosis or osteopenia in a very early stages. So by doing this test every year, especially after the age of 45 years, we can identify where we are traveling, which bones are weak, so that we can give the bone strength by supporting them with a good dietary sources of calcium. If vitamin D3 is deficient, we can supplement with the vitamin D either with a good sunlight. Along with that, we can give vitamin tablets. If a vitamin D is totally insufficient, they have to take a longer duration of vitamin D medication. Or normally the vitamin D level generally around 30. If it is less than 30, say range between 20 to 25 something, this is called uh, insufficiency. It is insufficient. We can supplement with the vitamin D for a shorter period of 8 weeks or so. But there are some people that is totally deficient. I've seen even vitamin D levels 4 and 5. So all those people are more prone to develop all this bone problem, chronic fatigue syndrome, and even vitamin D correction will help to improve the sugar control. Next slide, please. Oh, okay. So let us see about the diabetes thing. Osteoporosis, we've been discussing about it. These are the statistics, like they got a twofold increase to develop osteoporosis. This is when compared to the non-diabetic people and all these things. I like to highlight a very important factor in this. What are the bone healthy foods? The any dairy product, but it should be low fat dairy product. Either it is curd or yogurt or buttermilk, low fat milk. Every diabetic patient should take at least 1 glass of low fat milk. It is mandatory. So, and mushroom is a good source of vitamin D. And all these drumstick leaves, ragi, the millets, the finger millet, curry leaves, all these are very good source of iron and calcium. Next slide, please. Okay. And I've been telling about osteoporosis and what are the diet and all those things. And apart from that, the bone strength can be improved if we do a regular yoga, regular exercises. Then only the bone strength will improve. Many people, many of my lady patients, they say, I got knee pain, I cannot walk, I cannot do exercise. But it's not like in olden days, like you need to walk continuously for 30 minutes, 40 minutes if possible. Fine, okay. If not, also, just walk 10 minutes after breakfast, nashta, 10 minutes after lunch, 10 minutes after dinner. The 30 minutes walk, I'm talking about the people with the diabetic women or men with the osteoarthritis or people who have backache and all those things where they cannot walk continuously for 30 to 40 minutes. They can walk 10 minutes after breakfast, 10 minutes after lunch, 10 minutes after dinner. That's one way. The other easiest way is that don't sit more than half an hour. If you sit more than half an hour continuously, especially people like us, we give consultation for hours together, or people do desk work, we sit for a long time. Sitting for more than half an hour is equal to smoking 5 to 10 cigarettes per day. Sounds very scary, is it? So, better to avoid sitting for a longer period of time. You can go a mile walk in between. Another easy way to do physical activity is once in 2 hours. So, for example, 8 o'clock we go for a 10 minutes walk. Again 10:30 go for 10 minutes walk. Like that, from morning 8 a.m. to 8 p.m. This is for the housewives. They can walk once in 2 hours, 10 minutes walk. And there are nowadays speedometers is available, step count is available. You can walk for 10,000 steps per day. All those things is available. So, but anything works if you start aiming it and start from today itself. You start walking. Then I already told about the vitamin D correction. And not only walking is the best exercise. Apart from that, we have swimming, jogging, and so many good exercises there. Exercise apart from the aerobic exercise, the flexibility exercise, the strengthening exercise are very important. Especially for women in the morning time, as soon as they get up, the joints becomes very stiff, especially the finger. So the stiffness, if as soon as you get up from the morning, you can do a deep breathing exercise, pranayama, and you can do a simple exercises, the movement on the all the joints, the fingers, in the wrist, in the shoulder rotation, neck exercise, a knee exercise. This is called warming exercise and start you feel better. And many patients, diabetic patient, as soon as they get up from the bed, they get the pain in the feet, especially in the sole of the feet, the calcaneum area. This is because the sugar gets deposited overnight in that place. Once you start walking, they feel the pain reduces. So morning as soon as you get up after finishing the usual rituals, you can keep your feet in a warm water, put some haldi, put some crude salt, soak your feet for 5 to 10 minutes. It improves circulation in the feet and it also strengthens. The circulation improves. It is good for a bone and it reduces the sugar deposits also. So regarding next slide, please. Okay. So diabetic patient I told about the higher prevalence. Now let's see about the thyroid. The thyroid and diabetes are kith and kins. We're seeing a lot of young women having thyroid problem. So any diabetic person, they feel the sugar is fluctuating too much. Better to check the thyroid levels. Because there are two types of thyroid problem as we all know. There is something called hyperthyroidism, other is called hypothyroidism. Hypo means the thyroid hormone is secreting less. Hypo means the thyroid hormone is secreting high. So any diabetic patient says that I'm following diet properly, I'm walking regularly, I'm taking medicines regularly, but why my sugars are fluctuating? Or if somebody says I'm developing frequent low sugars, we should check the thyroid because hypothyroid can produce recurrent low sugars. Maybe a hidden one. Same thing with the hyperthyroid. And the diabetic person with the hyper functioning thyroid, the sugars will rise like anything. So even if we keep on changing the tablet also, sugars will not get under control unless otherwise you treat the thyroid. These are the simple practical tips I am telling. The next slide please. Thyroid affection occurs more in the diabetic population compared to the non-diabetic population, which I told about 6% in the non-diabetic means 10% in the diabetic patients. Of late, I'm seeing a lot of male diabetic people having hypothyroid. Okay, this I already told. Next slide, please. Okay. Another important thing I like to tell about what is a thyroid. Any diet for a thyroid is it's better if anybody takes a thyroid tablet. Better to take only in the empty stomach and avoid taking any beverage like coffee, tea, anything for at least for half an hour to 1 hour. Water can be taken because a thyroid hormone along with the thyroid tablet, if we take this coffee or tea, it reduces the efficacy of the medicine. And people with the thyroid problem, better to avoid too much cauliflower or broccoli, all these cruciferous vegetables has to be avoided. Too much millet, soya, all those things to be avoided. Not only that, all thyroid people should check the bone strength and they should check the cholesterol level also because hyperthyroid itself can produce dyslipidemia, abnormal cholesterol levels. So thyroid, whenever a person coming with a diabetic person, good sugar control, but cholesterol levels are not reducing in spite of diet and a statin, we would recommend the person to do a thyroid test. And they found hypothyroid, the moment they treat the thyroid, his cholesterol levels will become normal. So all these things are interlinked. Diabetes, hyperthyroid, hypertension, everything are kith and kins. Next slide, please. Depression. Depression in people with diabetes is much higher when compared to the normal population. And women experience more depression than men. The risk of developing depression increases in the women with diabetes. Already, women are more prone to develop depression, and in that case, if they become diabetic, still the risk doubles, triples to develop depression. So, especially, we have seen a lot of cases of postpartum depression. After delivery, say about few weeks after delivery, if the pregnant mother, after delivery, what happened? She's not lactating the child properly. She's not mingling with the family properly. We should watch for a depression in the lactating mother. The post-delivery depression is quite common. If it is identified and treated earlier, we can prevent so many complications. Next slide, please. Okay. So instead of before coming to the thing like what are the precipitating factor why women develop so much depression when compared to the male population? The main thing is a hormone problem because the hormone problem because of the pregnancy, menopause, hormone fluctuations push a women to develop depression. The extent of depression intensity is more when compared to the male population. Next slide, please. Now let us see how the stress operates. The stress, the chronic stress, the fight or flight phenomena. See, normally what happens when we stress, the cortisol hormone is secreted to fight against this problem. So this cortisol hormone makes our insulin to work less. Thereby, it increases the blood sugar. So any person in a chronic stress, they'll keep on secreting the cortisol hormone. So the cortisol hormone will be blunting the insulin secretion, thereby push a person to develop diabetes. Next slide, please. Okay. Uncontrolled diabetes in men. Now let us see about the infections. What are the infections that diabetic women can develop? Most commonest one is a urinary tract infection like recurrent UTI. They may have a bladder dysfunction, like unable to control urination, or for example, if they hold the bladder for a longer period of time, they will not be able to void immediately, or they may develop a severe lower abdomen pain. This is called neurogenic bladder. And all these things are quite common. Some patients after delivery may develop urinary incontinence. Like there is a dribbling of urine even if they laugh and sneeze and cough, the urinary incontinence. All those things will affect the diabetic people. How? See what happens. As an infection, we all know the recurrent UTI the infection can spread up to the even for the kidney, producing pyelonephritis. So decreased renal function, some people they develop even abscess in the kidney. Now how to prevent this? Next slide please. Diabetic people, if they have a recurrent urinary infection, can also have a fungal infection. Because in a woman, the urethra and vagina remains, vagina just below the vagina, we have an urethral passage. So urinary infection can spread to the vagina, vaginitis infection can come to the urinary thing. So both has to be treated. And a diabetic people will experience more fungal infection because in a good sugar medium, the bacteria thrives. The fungus grows like anything. It's a good media for the bacteria and the fungus to grow. Even if we get treated for the white discharge, the vaginal infection, if we don't keep a good sugar control, the infection will be recurring often. Next slide, please. And how to maintain a good sugar control? We've been keep on telling, but if you develop an UTI, what are the precautions to prevent this? One thing you have to maintain a sugar control. HbA1c around 7. You should take adequate water. You have to hydrate yourself. 2.5 liter to 3 liters per day. And as soon as you get up from the bed, you should take about 200 ml of warm water in the empty stomach to detoxify yourself. And you have to consume water-rich vegetables like snake cod, rich cod, chow chow, and all those things. And should take more buttermilk. See, buttermilk are free foods. One big tumbler of buttermilk will give only 15 calories, 100 calories. And you should hydrate adequately. During summer, watermelon can be taken. Muskmelon can be taken by diabetic people if they have an adequate sugar control. So like that, taking water-rich fruits, water-rich vegetables will help you to prevent, along with keeping good sugar control, can prevent developing urinary tract infection. And most important thing is called double voiding of urine. And not only that, once in 2 or 3 hours, try to hold urine, never hold urine for a longer period of time. Women, after the physical relationship, has to do a double voiding of urine to prevent infection from a sexual partner. Next slide, please. Okay. So, in a type 2 diabetic people, we have to be, people come for rest of contraception and all those things. Yes, diabetic men can take any type of contraception, but you have to be little cautious with certain things. Like taking OC pills for a longer period of time can lead to some problems. They may aggravate a kidney problem, can aggravate a retinopathy problem, and all those things. And people with the copper T devices like UDs and all, and if they don't keep a good sugar control and no proper hygiene, they can develop pelvic inflammatory disease. So again, the important thing is keep a good sugar control. Hydrate yourself well. Next slide, please. So last is about the fertility. Diabetes can affect the fertility indirectly because it increases the androgen level. The estrogen receptors the body reduces. So because of the fertility rate becomes less, and not only that, the diabetic people they may have a polycystic ovarian disease, so periods will be irregular and so on. So it's better, and not only that, the sexual drive will be less for the diabetic women when compared to the non-diabetic women. So, and the vaginal dryness is quite common in the diabetic women. Not only the mouth dryness, the vaginal dryness, all this because the uncontrolled sugar blocks the secreting glands. So everything becomes very dry. And because of that, they may have a pain during the intercourse. So because of that, they develop all these problems like they lose interest in that. They may develop severe pain in the vagina and all those things. Now all these things can prevent they may reduce the fertility rate. Next slide, please. Again, the thing is that maintain good sugar control. Maintain to improve the fertility rate. You again need a good sugar control. You should maintain ideal body weight, and not even if you can lose just 5 to 7% of the initial body weight, your insulin sensitivity increases, and it increases the estrogen receptors in your body. And all polycystic ovarian disease, girls with symptom has to be treated because once they go into a married life, the risk of fertility rate becoming infertile is quite high. So, not that every polycystic ovary, if you see in the scan, shows polycystic ovary to be treated immediately, it's nothing like that. But if you have a polycystic ovary along with the symptoms like irregular periods, prolonged periods, or they have hirsutism, excess hair growth, androgen excess, it's a good time to treat. If we treat now, two benefits. One, in future, the fertility rate can be improved. And second, we can prevent such girls to go into type 2 diabetes in future. Because all polycystic ovarian disease people have insulin resistant, this insulin resistant can push somebody to develop type 2 diabetes in future. Next slide, please. Not only that, before planning for pregnant, it's always better to go for a pre-pregnancy counseling. So by going for a pre-pregnancy counseling, we can understand what are the risk factors and how to prevent this, how to plan a healthy pregnancy so that at the end of the day we can have a healthy baby and a healthy mother. So long we've been talking about how diabetes is different in women, how diabetes can affect the women in a worse form, and what are the problems they undergo and all those things. But remember, diabetes is preventable, it is treatable, and nowadays diabetes is even reversible if it is detected earlier. Within 1 year of detection, if the HbA1c is less than 7, it is possible to reverse a diabetes. We've been enumerating so many complications about diabetes just to create an awareness, not to create fear in all of your mind. So, to understand the thing, yes, all these things are possible, but we can prevent all these things. So, here comes the importance of diagnosing at the early age. Don't diagnose diabetes once the symptom comes out. So we have to diagnose in the early stage. For example, once if we develop increased loss of weight, already in a glycosuric thing, what is the use of checking thing? If you have a strong family of diabetes, if you are overweight and obesity, and if you have lot of stress, better to check for your sugars at least once in a year. So diabetes is preventable, treatable, and even reversible also. Most important thing is consumption of a balanced diet, reduce the intake of carbohydrate, stop simple carbohydrate, and reduce simple carbohydrate as much as possible, increase the protein, and you can consume moderate amount of unsaturated fats like nuts and all those things. A regular physical activity, yoga, meditation, pranayama, all this maharasana, tadasana, all those things definitely help the diabetic people. Stress management, stress management techniques that we follow, and not only that, most important, once you start on medication, please adhere to the medicine. Nowadays, the diabetic medicines are very renal friendly, cardio friendly. Lot of scientific advances come in those days. In my 30 years of my practice, in those days we had diabetic medicines which treat only diabetes. But nowadays we have medicine which can prevent heart attack. Not only it controls diabetes, it protects the heart, it protects the kidney. There are some diabetic medicine even protect against cancer also. So your doctor will decide which is good for you. Next is we adhere to the medicines regularly and a regular monitoring of sugars are needed. We can use the glucometer, a standardized glucometer. Once in 3 months or 6 months, you can go to the lab, do the test for your check for your sugars, your HbA1c, your kidney function, all those. And not only that, you should regular monitor for the diabetic complications like check your ECG or echo heart or a stress test once in a year. Check for a DEXA scan, for especially for a woman after the age of 45. Check for the DEXA scan. And most importantly, young women, they should always have a self-examination of the breast daily to find out any lump present in the breast. And moreover, if they cross more than 45 years, and if there is a family history of breast cancers, they should undergo sonomammogram every year. I strongly believe prevention is better than cure. It's better to be proactive rather than be reactive. So regular checkups with even if you follow a good diet, physical exercise, monitor your sugars, reduce the stress, you definitely need the help of a doctor to adjust your medicines. And it is 100% possible that diabetic people can live live well with the diabetes even than the non-diabetic population. Next slide. So, healthy women, healthy India. Thank you for the patient listening.
Yeah, thank you, doctor. We have a couple of questions which have come to us through YouTube. Uh, there's one question from Pooja: how to reduce the risk of diabetes where a family history of diabetes exists?
Okay. First thing, if you're overweight, you should first reduce your, because there is something called modifiable factor, non-modifiable factor. So modifiable factor means it can, see, family history, our genes we cannot change, but some things we can modify. If you're overweight, try to reduce your weight. Even if you reduce 10% of the body weight, do a regular exercise. The regular exercise. And if you have a thyroid or a polycystic ovary problem, we should treat for this. Try to take a balanced diet. Try to have a positive thing. Like positive, don't take up too much stresses. So if you follow this, and in addition, check for your sugars, HbA1c or a glucose tolerance test once in 6 months. If we detect diabetes earlier, we can prevent it.
There's one more question from Mr. Rajiv. Is taking protein diet in place of carbohydrate diet good for diabetes?
Yes, sir, we can reduce the carbohydrate. Carbohydrate is definitely needed. You should not totally depend on protein. We can initially, actually, our Starch India study showed throughout India we consume about 60 to 65% of carbohydrate. So, from 60% of the carbohydrate, if we can reduce the carbohydrate to 30% and increase the protein content. For example, in the breakfast also you take, if you take idli or dosha or something, take dahi, take curd. In the lunch, also add some protein. Evening snack, have some sundal. Or you can take some paneer. Like that, adding protein and the frequent interval, your sugar will get under control because protein will prevent these spikes of the blood sugar. But you should take a carbohydrate but reduce the content of the carbohydrate, increase the proportion of the protein.
Uh, One more question from Mr. Anthony. Are there any good substitute for sugar that one can have?
Natural sugar substitutes are available, sir, but again they should be taken in a stevia. Some natural sugar substitutes are there, which is taken from the flowers and all. Can be taken, but take in a limited quantity. I would prefer to, instead of the sugar substitute, is we can, if the sugars under moderate control, we can try that like country sugars we can take in a smaller amount, or a good honey, crude honey can be taken in a smaller proportion.
I'll just take one or two more questions only. Is from Mr. Hitesh, is diabetes hereditary? If mother has, then what precautions to be taken for child?
So, I mean, if a mother is having diabetes during pregnancy, you are asking about the child, how to prevent diabetes for the child, sir?
Yes, yes.
Okay. The first thing is during the pregnancy itself, they should maintain a good sugar control. Second, the mother has to lactate the baby fully, at least for 1.5 years. The baby should not be given an extra nutritional supplements. Breast milk is the best one to prevent somebody developing diabetes for the baby, especially for the babies born to the diabetic mothers. And third is the child should be taught a good physical activity from a very young age itself. And they should taught to take a good number of vegetables, especially fiber vegetables, fruits. All these habits has to be cultivated. And at the age of say about around 10 years itself, they should start playing games and cycling and all those things. They should be follow a good lifestyle from a young age itself. If we follow the lifestyle, we can prevent it developing. There is no medical management for this, sir. Only lifestyle management.
Last question is from Madam Jalaja. Are there any correlation that has been drawn between COVID and diabetes? Are those affected by COVID at having the higher risk of diabetes anyway? Because we saw many
Definitely.
people during COVID,
Definitely.
they had high diabetes.
Yes, sir.
And
It's a
post
very
once
true, sir.
they got recovered, the diabetes was normal.
Yes, sir. Very true, sir. We also witnessed a lot of new onset of diabetes. So the thing is that this COVID virus has even affected, damaged the pancreas, where they developed, so that the insulin got distracted. So they developed the high sugars. And moreover, in the first wave, we are forced to use steroids and all, because to prevent the cytokine storms. All these things raise the sugar levels. But if the person is not an high risk individual, this diabetes disappears at the period of 3 months to 6 months. But we should always keep a watch on it. I would strongly recommend these people who had a COVID and developed diabetes and it has disappeared now, keep watch on the sugar levels. And certain proportions say about our studies have showed 5 to 15% of the people continue to remain diabetic even after the COVID infection over. Almost now 1 year they continue to as a diabetic. We are following those patients.
Doctor, I think we have taken more than the required time allotted to us. We have with us our general manager, Madam Jafia. Actually, she got stuck in some meeting. She was supposed to moderate everything, but I had to take her position. Now she is back, and I'll request her to propose the vote of thanks.
Good evening, Doctor, and on
Good
behalf of Indian Bank and the entire fraternity of Indian Bank, as well as the women employees of Indian Bank, I really wanted to thank you for your the very best presentation made here, because it was, though we know that diabetes is a very like common diseases, and people are not taking much of a care to them. So that awareness that like diabetic per se, it is not visible there, but it can affect many of our organs, as well as it will create lot of problem. So that part of awareness has to come, and right from the child to maybe up to the age of like till there, this diabetics day by day it is getting increased only. Everybody can be get affected, type 1 or type 2 or whatever it is. So that awareness has like that is there, and we have like in our YouTube video it will be available, and we can like almost our employees or their family members can benefit from your this wonderful presentation and the awareness program. And we thank you from our heart of from deep heart that you have taken time. I know that you are a very busy person, and you were up to 3 o'clock. You were in the hospital, and you have really made it possible for to come and make this presentation. And I know that you are also physically little challenged these days. In spite of that, you have taken 1 hour sitting and talking to us. That is very nice of you, and really want to thank. And I really wanted to thank Mr. Bajaj, who is general manager and in charge of our communication department, and so for arranging this wonderful opportunity for all of the Indian Bank employees, as well as their I feel that their family members, including customers, can be watched. So I wish a very healthy like lifestyle for all of us, and we want you to thank very much.
So we also thank Madam Jafia. She only referred your name, and we got a very good presentation and very good awareness about diabetes. I think our colleagues and our customers are well benefited out of this. So once again, thank you on behalf of the entire Indian Bank family and fraternity. So with that, we conclude. I thank all the viewers and the persons who are present here for watching it and giving their time for this seminar. Thank you, madam.
Thank you, madam.
Thank you very much. Thank you very much. It's a pleasure. Thank you.